Hello, and welcome to this week's episode of the Axial Spondyloarthritis Podcast. Today I wanted to look at something a little different. Earlier in the day, I happened to actually be sitting there looking at one of my nails that's kind of ridged really bad to where there's an indentation and it rises up on both the sides of it. And just so happened that I looked at an article today on My Spondylitis Team that was talking about that very subject, which is issues you can have with your nails and how that can be a lesser side effect for people with axial spondyloarthritis. So I thought I would go through this article a little bit with you, and I'll be a link to it in the show notes. I would encourage you to go out and read it, and it's pretty interesting. Again, this is not medical advice. There are some supplements that this author mentions. You can take those, talk to your rheumatologist and your general practitioner to see if some or any of those would be applicable to you. The title of the article is 6 Ways AS Can Affect the Nails. The author goes on to talk about how she used to have these really long, pretty nails and how they've run into some issues as her AS has gotten worse. For me, though, obviously I never had long nails, but I have had the pitted nails and the ridged nails, and they've gotten progressively worse through the years. So it was with curiosity that I read to see, what has this covered in here? Because I think with almost 200 episodes in, I've never actually done a topic on this. I think I've touched base on it before, but never a whole episode on it. So the author goes on to mention that although nail changes aren't among the most common symptoms of AS, she goes about 10% of people with AS also have psoriasis, which causes nail symptoms, and up to almost 80% of the people with it. So it's important, she mentions, to talk to your rheumatologist about all of your symptoms and make sure your health conditions are properly diagnosed and treated. One of those things that she mentions, number one, is ridges. Ridges in the nail may be visible going vertical, up and down. This symptom causes the appearance of grooves, which may be deeper and dark or shallow and subtle. And I personally have a little bit of both across my different fingers. Some people may instead notice ridges running horizontally from side to side on their nails. This is particularly common among people who also have psoriatic arthritis. No matter which direction the ridges travel, they're worth mentioning to your rheumatologist. Number 2, discoloration and thickening. In some cases, the author mentions, the nails may change color or get thicker, particularly if they're affected by both AS and psoriasis. The color change can range from yellow and light brown to white depending on the cause. Because having both AS and psoriasis can increase the likelihood of developing discolored nails, again, be sure to report these symptoms to your healthcare provider right away. You may be living with psoriasis as well as AS and not realize it until you notice nail changes. Number 3, splitting and peeling. Your nails may become more delicate and start to split, peel, or even crumble. As one person from my spondylitis team wrote, they split and break very easy. And this I see across a couple of my fingers. It's interesting. I've got some of this on different fingers. It's not a uniformity where it's just ridges or it's just this. I get a little bit of all of it. Minor splits or chips or breaks in the nail, those might not be much of a cause for concern. But if your nails are separating from the skin and causing swelling or chronic pain, then again, report this to your healthcare provider. Number 4 is pitting. Some people with AS may find that their nails have small depressions known as pitting. These tiny pits, they can be shallow or deep depending on how badly affected, and you may not see them but can feel them when you run another finger up and down your nails. Pitting isn't common among people with AS as it is with other types of spondyloarthritis, such as, again, psoriatic arthritis. However, in rare cases, the author reports that nail psoriasis can be found in people with AS. Pitting is caused by irritation or inflammation in the nail matrix, which is the point where the nails begin to grow from your skin. Number 5, slower growth. You may find that your nails grow more slowly while you're living with AS. This can result from the use of certain disease-modifying anti-rheumatic drugs, DMARDs, such as methotrexate. Although this condition is likely to resolve over time, it can be frustrating, especially if you're trying to grow out a broken, split, or discolored nail. This symptom may not be serious enough to prompt your doctor to change your AS treatment, but it's still a good idea to mention it, when you meet with them, because all these little pieces are what to help put the puzzle together for maybe a psoriasis diagnosis if some of the pieces of AS are not quite bearing out the way they should be, or if there's other things that are showing themselves. So all these symptoms themselves may not be serious enough to prompt your doctor to change your AS treatment, but it's still a good idea to mention it. And then 6, ankylosis. So I probably butchered that. Some people with AS experience nails lifting from their nail beds, leaving white marks underneath. This condition is more commonly associated with psoriatic arthritis and psoriasis, but it may also affect individuals with AS or somebody that's got a combination of the two. Other causes include fungal infections, thyroid disease, and reactions to certain medications. I've seen this on some of my toes, so I have firsthand knowledge of how that looks, feels, and what ends up happening with the nails themselves. There's no real way to treat any of these directly unless it's maybe determined instead to be a fungal infection. Then there are some things that can be done. But one of the ways that as you go along, you can help to preserve them, the author mentions, is making sure you do prevention and protection. To protect your nails, try some things like trimming them short to keep them from lifting off the fingers and toes, or so that they don't build up excess nail and cause you pain as they start to thicken. If you have trouble reaching your toenails due to spine changes, consider purchasing a pair of long-handled nail clippers or going to a nail salon for nail care. Keep your nails dry and clean to prevent nail infections, and then wear gloves when washing dishes or gardening and avoid irritating the skin around the nails, which may cause flares. Don't cut or push back the cuticles because an injured cuticle, can lead to an infection. And then if you're trying to wear artificial nails, you might want to skip that. Artificial nails apparently can increase the risk of your nails separating from the fingers. So instead, the author mentions opting for nail polish or gentle buffing. As far as vitamins go, one of the things you can talk to your doctor about is biotin. Biotin is responsible for strong nails. It may be something that you're deficient in. It may be something that your doctor wants you to take extra of, but talk with them before adding it to your regimen of vitamins. The other one that I think we've covered because it helps with numerous other items, and this is one you really want to talk to your doctor about if they have not brought it up to you, is vitamin D. Low levels of vitamin D are often seen in adults, and studies show that people diagnosed with AS generally have lower levels of vitamin D. So a lack of vitamin D can involve bone issues, nail changes, all sorts of different things. So again, talk to your doctor. They may want to put you on a supplement. All of these are not one thing that indicates you have AS if you listen to this and you haven't got a diagnosis yet, but it could be one of the pieces of the puzzle. So when you go in to talk to your doctor, let them know that you're dealing with some nail issues, some ridging, some pitting, they chip or break easily, any of these type of things that could potentially help to push it towards a diagnosis of AS or something else. But again, as you start to add in things and eliminate things, you end up working towards that proper diagnosis, which is what is then going to allow you to hopefully maintain and increase your quality of life. So with that, thank you. I hope you all have a wonderful week, and I look forward to talking to you soon. Take care.